Hello, Dr. Don Jewell for the Non-Surgical Clinic. Today I'm shooting our second Zerona video. This is for our patients, prospective patients, so they can understand the procedure. The first video was more the logistics. You saw me doing the PowerPoint presentation. This is more the visual presentation. So what we're going to do today is we're going to use the TV. We're going to use the original marketing video for Zerona that came out quite a while ago. Then we're going to use our whiteboard to explain this. So we're going to go through and show more of the visual presentation of what happens during the Zerona body contouring procedure. So remember, in our clinic, the Zerona is a whole body healing event, not just about lipolysis. Remember, we've done 5,000 patients, 10 years, etc. Now we're putting all this out there for the public to hear about. We're moving on more from this point. We're going to do so much body contouring. We're going more autoimmune restoration, etc. That's the next phase of with tissue healing with the lasers. We're also going to explain the difference between true cold laser and the LED light devices. So we're going to start with the original video. Here's the Zerona, and I'm going to fast forward it. You can watch this video on YouTube. There's a 3-minute version and a 10-minute version, but this is the original marketing video. Now remember, I tell our patients when they come in, it can be overwhelming. There's a lot of things to take in about our protocol, but you have to remember as a patient, here's what's great. It truly is no pain, no surgery, no downtime. You just come in, treat, follow the protocol, and off you go. The best thing is no scars, okay? And I'll be honest, our best patients, the patients who aren't lost on day one, the patients who understand, are the patients who have watched the videos. The patients who don't do their paperwork in their folder or watch the videos, they come in on day one and they're very confused, okay? It doesn't have to be that way. That's why we're shooting these videos. So watch the video, come in, and remember, when you come in, you want the laser on your skin, just like in the videos. Okay, so prepare for this. Your level of engagement is directly correlated to how well you're going to do with this procedure, okay? So now we're going to go through the video real quick. I'm going to fast forward to the real-time MRI and show the moment of lipolysis. So, here we go. Sorry for the pause, but just in order to do this video, we just have to do it this way. There's a true cold laser. You'll notice the Zerona is the only device that rotates, and that's body contouring because it wraps around your body. The copies of the Zeronas, which I'll use that term loosely, or the LED light devices do not rotate like this, okay? They're on paddles, they go on the skin because that was the one patent they couldn't steal, okay? So here we go, here's the moment of lipolysis. Okay, that's what you want. So, in our workshops that we used to do in-house, we always go to the whiteboard and we show the lipolysis moment. So that's right here. Here's your fat cell. Here's the laser hitting it, and we're going to work. So it's right behind me. The whole secret is, where does this fat go once we liquefy it? It's got to go somewhere, right? So if you watch the first video, you remember, true cold laser doesn't do anything unnatural, okay? It's not going to cause anything that normally doesn't happen in a healthy body. So let's do some homework, okay? Zerona, Virtue, and EVRL. 3 types of cold lasers, okay? Zerona's red, Virtue's green, EVRL's purple. So we talked about that in the first video. You're in body contouring, basic body contouring, you're going to be doing the Zerona laser, which is red. So here's your fat cell, and here is all the laser hitting it, causing those pores to open. Well, where does that fat go? It has to go somewhere. So remember, it has a journey. Okay, so this comes in your folder. This is also in the PowerPoint video. The journey simply is this. Interstitial space, lymphatics, liver, and bloodstream. Each treatment takes about 3 to 5 days to process. So in the original Zerona video, remember, these are all 6 treatment doses done over 2 weeks, but give your body about a month. Remember, it's a whole body healing event. It's going to take time. So if you have 6 treatments, 6 times 3 to 5 is anywhere from 18 to 30 days. Most patients, I tell, that are happy, give it 28 days. As a patient, you will begin to see changes about visit 4, okay? Not visit 1, 2. Now, that could be different for everybody, but typically it's about visit 4. And remember, here's the journey. Liquefy the fat, through the interstitial space, lymphatics, liver, bloodstream. That's a normal procedure that happens when diet and exercise work. When diet and exercise no longer work, this shuts down for some reason. Your body has stopped performing lipolysis. So that's when I tell people that come in for body contouring, if diet and exercise have ceased to work, you're typically in a state of systemic inflammation, which also means you're metabolically sick. Okay, so that's in the first video. That's why when the Zerona came out, it's a little bigger than most people realize. Okay, so that's the doctory stuff. Now, here's the beautiful thing about true cold laser, is lasers are monochromatic, one color. They're also coherent, okay? That's the end of discussion as far as lasers and LED lights go. LED lights are incoherent, okay? Lasers are focused, LED lights are not. So that's why we don't worry about LED lights. We don't use them. We use the real deal, okay? There's a lot of debate out there. Does laser like lipo work like Zerona? I'll tell you, after 10 years, 5,000 patients, no. We've had all the copies. We choose to stick with the original, and you know my feelings if you've watched the original video. Okay, laser goes to work in your Krebs cycle. Here's why we love cold laser, okay? This is why most docs that use laser, be they veterinarians, chiropractors, PTs, dentists, etc., use the laser for the effects it has on the Krebs cycle, okay? Your Krebs cycle is your DNA, the mitochondria of the cell, powerhouse. The laser goes there and goes to work. It causes a 66% increase in activity, meaning you will generate more ATP. This will give you more energy. So when you watch the video about the 5, which I'll recap here with the picture, the first thing you're going to notice under true cold laser body contouring protocol is more energy. Okay? The laser can't not do its job, and it doesn't know the difference between cell types. It just has a different effect on a skin cell, a muscle cell, a hair cell, etc. It doesn't have any negative effects, only positive. This is why we love the laser. It's the effects on the Krebs cycle. Now, being a functional medicine clinic, we work in the gut-brain axis. So, that's here. These are your villi up to your brain. The little T in between, that's your thyroid. Okay, the reason we're so good at the Zerona is we understand the thyroid. When the Zerona launched, and we had patients going through it whose results were a little stalled or slowed, we began to assess their thyroid. Remember, this is 10 years ago. And we noticed every single time they had a compromised thyroid or a low-functioning thyroid. The typical argument is, I've had my regular traditional doc assess it, it's fine, my TSH is fine. Well, friends, TSH is only one of 9 markers for your thyroid, okay? We have this conversation all the time. This comes in your autoimmune folder. We completely examine your thyroid with proper and complete testing. We're not going to just look at TSH. We're going to look at you in the gut-brain axis, so watch the thyroid video for that. As mentioned in the other video about Zerona, 2017 was a huge year, huge for us. Red laser, or true cold laser, not LED light devices, were proven to regenerate and reactivate malfunctioning thyroid tissue. So we have the study for that. We can email it to you, okay? So, remember, liquefy the fat. That's a normal thing when diet and exercise work. Stage 1, lymphatics, liver, bloodstream. And if you watch the first video, where in this phase do most people have difficulty? It's the liver. If the liver can't handle the workload, or if the lymphatics can't handle the workload, or third, if you just don't have a fat-burning metabolism, remember we call that stages 1, 2, and 3, which you can see, lymphatics, liver, bloodstream. If the fat can't complete its journey through 1 through 3, it's simply going to go back into storage. That's why we have a protocol, and we get you going on all these other things that assist your body in this procedure. Okay, working in the gut-brain axis, we reactivate things. So now, we're going to show you what true body contouring does by going to what I call the 5. So once again, be a little patient because I'm shooting this video very archaically, where I'm just manually going through. Maybe one day we'll get somebody to edit everything down for us. So let's look at the video. Now, the thing is, you want to dress like they dress in the video. Sorry, I'm back. Because you want the laser on your skin. You don't want the laser on your clothes. It will go through clothing. But you want to see the laser affect your skin. You'll get a better dose or better treatment when it's on the skin. Okay, so come in, have a change of clothes. This will be much easier for you if you simply plan your routine. Remember, you're going to be here for about 45 minutes for basic body contouring. Autoimmune patients are here from an hour to an hour and a half. Bring a change of clothes. Dress like this. It's just much easier to treat you than to try and deal with your work clothes and everything else. Remember, you're here to get results. Prepare for your treatment. You will do 10 times better. So here's why we love the Zerona. The patient behind me, this is the whole body healing event. So remember from the first video, the laser's not going to just work only where we place it. It's going to be like a pebble through a pond and spread through your whole body. So I tell everyone, and I shot an old video, which you can watch about the 5 components to body contouring, and here they are again. The first is more energy. How that translates is just look. You're going to be physically stronger. Look at her posture and stance. She's more aggressive. Second, less inflammation. Okay, just look left to right. You can see the gross level of systemic inflammation in this patient. When you look to the right, her level of inflammation has gone down, and we always tell our patients, remember, if you can take your finger and poke a dot into your skin and leave it there, you're in trouble. Everybody knows that, okay? Look at the patient on the left, very grossly inflamed. Those are where most docs who do cold laser, they simply just work in elements 1 and 2. More energy, less inflammation, tissue healing, pain reduction, okay? Because those patients are extremely compliant, I'll be very honest, okay? Once you start to drift into aesthetics or body image, you get a different mindset in your patients, okay? It's more difficult. This is exactly why, and I'm chuckling after 5,000 patients of body contouring, this is why most docs simply like, you know what, I don't want to do body contouring, body image, it's a very difficult world. Let's just simply do pain reduction, because when a patient has a broken arm, they comply. When a patient wants to come in for body contouring, not so much, okay? But we love you all, but after you drift into components 3 through 5, you're a touch more difficult, and that's okay. You can come see us, we'll get your results. Now here is where the Zerona outshines every other device that wants to be a Zerona, because you got to remember, Zerona's the original. This whole concept did not exist until Zerona was launched. You remember, body image is $1 billion industry. Everybody wants in the game. But see, not everybody wants to put their time in. That's why I deliberately did not shoot any videos until I had 10 years, 5,000 plus patients. So everything I'm telling you, I'm pretty confident because we've seen it all. I could have shot these videos 5 years ago. I chose not to. I let other people shoot videos, that's fine. Go to town. Here's why the Zerona is amazing. Take a deeper look. Remember, her whole body changed head to toe, not just the middle, but remember, the Zerona is going to give you that coveted spot reduction and work through your whole body. Now, element 3, skin tone. Look at her skin tone. Your skin is your largest organ. And muscle tone, that's the 4th. Look at her muscle tone, head to toe. Remember, look left to right. This is a 1-month change. Remember, this is pretty amazing. This is why body contouring never gets old, but that's why I've always expressed a true body contouring component. It's just a mini version of the autoimmune regeneration protocol, which is 3 months. Body contouring is 2 to 4 weeks, okay? Last but not least, she lost inches or fat. Okay, most people simply understand the Zerona as component number 5, inch loss, fat loss, but that's actually, believe it or not, a side effect. It's not the primary action, even though we've proven it induces this, but the laser works in the mitochondria of the cell, and remember, it does restoration and up-regulation. So I remember when we used to do these classes live, and I've had 15 people in the room, and their jaws would drop, and they would just look at me like, who is this guy? What is going on? I thought this thing just liquefied fat. It does, but it does so much more than that. That's why, once again, we don't even waste our time on the clone or copy devices, because they simply don't do what true cold laser does. Their constant argument is it's new technology, it's better technology. Friends, it's Home Depot technology, I'm sorry. LED lights cost pennies. True cold lasers are very expensive. More so, the Zerona is a more complex procedure than patients understand. Even for doctors that we train, it's a more complex procedure than people understand, because you're doing work in the gut-brain axis. You're doing restoration and up-regulation. So you've heard me talk about in the first video how I love my up-regulation patients because they will do anything to win. Okay? Well, now they don't have to cheat or break the rules. We're just going to work in the cellular level, taking them up a notch above everyone else. Okay? I love working with patients like that because they're extremely compliant. I still love doing body contouring because I get to introduce the laser to people who have never even heard about it, okay? 10 years later, there are still people that come to our office who haven't heard about this. And the sad tragedy is they, by default, think that a laser like lipo in a hair salon is somehow even remotely close to what a Zerona is in a doctor's hands. It's not. I'm sorry. Okay, so that's going to get some negative comments, but it's the truth. Okay, we love our lasers and we protect our lasers. And I'll tell you right now, you will not find a copy of the green or purple. Not at this point, because they don't know how to do it. Okay, so let's move on. Here's what's beautiful for body contouring patients. Look left to right. Could you do that on your own in 1 month? No, but with a coach and a destination and someone to keep you honest, remember you're going to be doing the Fit 3D body scans, which is an infrared camera, you're going to be happy, but you have to be patient, okay? Remember, you didn't get this way in a day or 2 or 3. You've got to give your body time to heal. So I tell people, it's like when you cut your finger and put a Band-Aid on, the Band-Aid helps, okay? But you're not going to heal overnight because you used the Band-Aid. Now, the Zerona is going to speed things up, but it's not going to fix you overnight. So I'll tell you that I'm telling you this because the people who say they're not happy or didn't give results simply just didn't give it time. They weren't patient, okay? So I'm telling you right now, if you're not willing to give this 28 days, this is not for you, okay? You should go in for surgery or go into a different type of procedure because you will not be happy if you're not willing to give this 28 days, okay? Give it time. I can't tell you how many times somebody comes back for their final scan and they're like, oh, I didn't realize I had to do this. Well, just on your last laser day, that's not your last treatment. You still have to process that treatment, okay? And you're processing the ones before it, okay? But it's your level of involvement and commitment will be how well you'll do. It's that simple. Now let's go a little deeper with the Zerona. Now here's where we start to go into functional medicine and why in our part of the country we are the only original Zerona clinic left, and nobody has been doing it as long as us. We are the clinic everybody copies. I can go into any clinic in my part of the country and find something that I generated years ago that they are currently using in their model. Now, I always give credit where credit is due. I know those who've helped me. Use what I've done. I don't care. Take this video, train your patients. That's why we're finally putting it out. But credit where credit is due. Okay. So now we're going to move forward in this video, and you're going to see why the Zerona gets a little bigger than most people realize. Now, here is the patient from the side. You see the 5 healing components, but now we're starting to go to work in the gut-brain axis. And I'll tell you, when the Zerona first came out, like I said, there was no cookbook. There was nobody to copy. There was no, here you go, here's your program, here's your protocol, just do this, this, and this. Okay? That's why the Zerona has such a dramatic love-hate relationship. It either fell into the hands of a doctor who was willing to master it, or somebody who thought they were going to make a quick buck. Okay? You hear me talk about the 3 I's. Innovators, imitators, and idiots. Imitators have moved on. Now it's just us, and lastly, the laser-like lipo crowd. That'll get some people riled up, but it's true. Okay, if you want a flashlight, I've got one in my glove box. You can have it. Okay, here's why I love the Zerona. Look at the patient from the side. She's broken in the gut-brain axis. Half her problem in the picture, very evident, obesity. Okay, it's America. Try to eat clean. Good luck. We've got videos on that. The other half is she has systemic inflammation. Look at her tummy. It's inflamed. So that's why I have this right here in the gut-brain axis. Patients have their villi, which are the little waves there, and they're full of tar. Okay? That gives you bloating and distension. Your pH and flora are askew. You're not digesting your food. You bloat and distend. Here's the other thing I tell my autoimmune or advanced care patients. You have to be willing to change your routine because your problem is everything you're currently doing has brought you to my office. If you're not willing to change, yeah, you're going to go through this, but of course it's not going to last because you're going to go right back to the lifestyle that brought you to me in the first place. And it's not easy. I go to seminars all about gluten sensitivity. It took me 6 months just for myself to convert my own diet to be a proper diet. It's a very difficult thing, but you've got to at least be willing to change. Now, the beautiful thing about the Zerona, it is a catalyst. It will work, but one of the major questions is, will this last forever? Of course not. Come on, be realistic. No. It's time for me to get a haircut again because I do laser on my head, and even though I do that, I still lose hair because I'm human. Can't stop that, okay? But, you know, we're going bigger, and you have to make changes if you want to get your results to last. That applies across the board to diet, exercise, et cetera, et cetera, et cetera. But the beautiful thing about the Zerona is our patients come to us, and we do those 2 things, restoration and upregulation. And we're going to fix you, turn things back on, and make it work faster. Okay, now look at the gut. Very inflamed because her pH and flora are askew. This leads to all things bad when the gut's not healthy. Things move north, attack the thyroid, attack the brain. The number one cofactor that comes in with Zerona patients is anxiety and depression. I don't know who's not depressed or in a state of anxiety when diet and exercise no longer work, and traditional medicine keeps telling them just go lose 20 pounds. They're like, Doc, I can't. Then they say, well, your thyroid's fine. Well, guess what? We find a broken thyroid every time. Every time. And you've heard me talk about vitamin D. Every time a body contouring patient stumbles in here, we look at their vitamin D. It is in the basement. It's so low, it's ridiculous. But see, vitamin D is not hero work. Remember I said, before I did this, I was a guy that ran out on the field, scooped you up, decided what to do with you, okay? Those aren't water boys. Those are certified healthcare providers, okay? Vitamin D is not hero work, but if you don't have proper D, you can't lose fat. So that's in a handout. I think we have a video coming out too, all about vitamin D. If you don't have D, don't expect to be healthy. But see, you're not running around town saying, hey, my doctor told me about vitamin D, he's the best doc on the planet. But when a doc saves your life because they fixed your heart, they're kind of your hero. Do you see? Functional medicine's a different thing. We're more of your concierge. Cold laser docs, we do hero work, but more we do long-term work. So when you see a functional medicine doc who specializes in cold laser, remember I said Google that, see what comes up. You're not going to find a lot of us. So her tummy's broken. So she's broken in the gut-brain axis. Okay? So those laser goes to work. Now the body you see next to her is a very healthy body type, but in America she would still be body shamed. Okay? Believe it or not, a lot of people come in and body shame Zerona patients. It's crazy because there's so much emotion tied to the way you look. In body image, it's a whole different patient. That's why a lot of docs are like, you know what, I'm just going to deal with the acute trauma people because they're easier to work with. Because the number one cofactor with body contouring is anxiety and depression, and those are the most grossly underserved patients that we see. They don't really get any good answers, just medicate or palliate till death is what we call it. The Zerona goes to work and induces those 5 healing components, and these people feel phenomenal, and they're like, I'm so glad you explained what was going to happen to my body because it was very different. Now, the other thing real quick, as we start to heal this villi, in the video, this video, when you watch it, you'll notice they talk about patients lose about 5 pounds. Well, we see patients losing about 5 to 10 pounds of tar out of their GI tract. It's not like you're losing weight. Normally, you're losing stuff that's been festering in your gut. We also do the liver cleanse, and that helps you get rid of that tar. So what we see are patients that come to us after they've gone to a clinic that does something like what we do, but without true cold laser, but they stand on the viaplate because the viaplate takes all those muscles around your core, and they're doing this so fast you don't know. They're pumping your core. Well, they pump that tar, but see, since nobody mastered their craft in these clinics, they don't know what to tell a patient who hasn't gone to the bathroom in 10 days because that tar has constipated them. Well, here's the answer. We do a little bit of vagus nerve work, turn the highway back on, open the road, a little bit of vitamin C, a little bit of magnesium, and things happen. I clean this train wreck up about once a week. Somebody will call us. Somehow they found us. Hey, I went in for body contouring. I got constipated. I don't know what's going on. I haven't gone to the bathroom in 10 days. And I'm like, come in today. We'll help you out. That's the number one thing we see with people who don't understand the Zerona protocol on this level. Okay. If you haven't gone to the bathroom in 10 days, that is not a small problem. All right, so let's move forward. Now, as you see in this video, every patient has a different body type. Now, I love this video. This was shot so long ago. You'll notice the patient did something we call Freudian slip. She just stroked her neck, okay? But she didn't have her neck treated. Now, you can treat anywhere in the body with the Zerona. If you remember, the original patients all done for this were treated in their midsection. The beautiful thing, and once again, why the Zerona trumps anything that wants to be a Zerona is because it works in the mitochondria of the cell. You get a twofold healing event. You get that coveted spot reduction, but you also get that moment of healing, and it moves down your body head to toe. So we tell our patients, think about it. When somebody's losing weight, what do you notice happens to their face? It begins to lean out, and it moves down. And I always say, okay, think of it this way. Why do diabetics lose their feet before their hands? Well, because they're dying, okay? And everyone says, well, they lose their feet because circulation and poor blood flow, which is true. But why does the body react that way? Because it's this simple. When you're doing cellular work and restoration and dealing with autoimmune, here's how the body works. You heal head to toe, okay? Because you protect the brain till the end. Watch my video. We talk all about the brain. okay? But you die toe to head. So we always have our patients put their hands and feet side by side. That's why we have you take your shoes and socks off so we can see how you're doing, okay? My friend who practiced traditional medicine at the local hospital, he's like, nobody looks at feet anymore. By the time they get to me, they're in dire situation. As you heal and as you go through the Zerona, you get that whole body healing event, and it works right where we're applying it. You get 2 to 3 times more inch reduction, but it spreads through your whole body. That's why when you watch this video very close, these patients didn't just change in the midsection, they changed head to toe, okay? But you have to remember, when this first came out, there was no cookbook. There was no book to open and say, ... 1, 2, 3, 4. You're getting 10 years of clinical experience here, and I tell everyone, when I bought the Zerona, I bought one of the first ones, okay? We also bought the first Virtue. We had one of the first purple lasers, okay? I got it. I had it for 9 months. Some people laughed at me. We spent 9 months perfecting this protocol. Then we took 10 years to make it even better. When you do what you do for 10 years, I still feel like I'm learning, because now we're going deeper. We're moving into tissue regeneration and other things with cold laser. This is what's so beautiful and why Zerona never gets old, is you get that coveted spot reduction and it goes head to toe. It's amazing. And every time a patient goes through this and they're like, okay, it was so much information I couldn't keep pace with you, but it's all happening to me. This is going to happen to you. And if you have eyes to see it, you'll understand it. But if you don't, you'll miss it. Okay? Look at her. Now here's what I also love about this video that they shot. I didn't shoot this, I'm just giving you the clinical pearls from it. She's got that up regulation glow. So watch real quick. There she is. She's standing on the stage with very wealthy doctors who have access probably to the best allopathic care on the planet. When this video was shot, this was not understood. Okay, we understood it, we hadn't quantified it, because remember, this thing was so big in 2008. It was so big, and honestly, 2008 it really didn't go very far, because it was almost too daunting to bring this on. Because you have to remember, there was no Zerona clinic. This didn't exist. But look at her. She's glowing. She's vibrant. She's outshining doctors. And remember, doctors should just be healthy because they're doctors. I'm teasing, right? But look at her. That's the beautiful part of the Zerona. It's very hard to teach and hard to quantify. But patients, I was telling them, your friends are going to look at you and say, what are you doing? And even for patients, it's hard to say, you know what? I'm seeing a functional medicine doctor who uses cold lasers. You're healing on a cellular level. You're healing head to toe. You're getting that restoration and upregulation, and that's what it looks like, okay? I don't even know if there's a word for that, because we love our labels, right? When you've got a disease, like, here's my label and here's what they do, blah, blah, blah. Not really quite there with that. The best we have is you're doing functional medicine with cold laser. You're experiencing restoration and upregulation. And it's the glow, okay? And that's what people covet. Okay? So remember again, this video, everything is here for your benefit. There's a lot of nuggets. Great picture here. Okay, well, we missed it. You're going to stack your scans and you're going to go forward, okay? Now, you'll notice that nobody looks the same in this video. So remember, this is raw and organic, so I'm just going to back it up. Okay. And I'm watching this through the camera while I'm talking to you. No shame. Here's what's awesome. This is that hard toxic fat. You have multiple cell walls, okay? Google it. Soft fat, toxic fat. We've known about this for a long time. This is the type of fat that builds, it gets hard and hard, and it's full of, guess what? Toxins and extra hormones, typically estrogen, okay? Your belly button's also like the equator, okay? You're going to have soft fat above, hard fat below. The laser doesn't care. What the laser does to hard fat is it strips that off, okay, and makes the fat soft. So what patients notice, first, your fat will become softer, and then it'll dissipate, and then you'll lose inches. Patients see it around visit 4. We'll see it right away. Now, when you have something like this is an amazing case. Unfortunately, this picture was cut short, but these patients typically have large bottoms and small tops. And why is that? Because remember, when you die foot to head. You heal head to toe. This, I wish they'd had more pictures of, because it's dramatic. You can see just a huge change in 1 month. Remember, in this original one, it's 6 doses 1 month. Okay, so we're going to go forward to another different type of patient. This, we have umpteen patient files just like this. This is why I love the Zerona, and if the Zerona only did fat reduction or lipolysis, this patient would not get the results she got. Okay, I can't tell you how many times I have a patient like this come in and they're just alligator tears, they're crying. They're working out every day of the week for 2 hours, but see, her problem isn't fat, okay? Remember, that's number 5 in the components of healing to the Zerona is the inch reduction via fat. Her problem is systemic inflammation. It's all in the gut. This is a broken gut-brain axis. And if the Zerona only did lipolysis and not tissue healing and inflammation reduction, this patient would have not gotten body contouring results. But because the Zerona is what it is, it's the true cold laser, and we had to add the word true because of the imitators and the idiots, so people would understand that you're actually getting the real deal and not something, that costs $3 out of China. This patient got results because she got the real deal, okay? And this is why we do what we do, because we love to watch patients heal. The other thing is, if you don't understand a patient's problem, how do you begin to fix it? You've got to slow things down, do proper assessment, proper testing, etc. And then you've got to change what's causing the problem. This patient, can you work out too much? Absolutely. Working out too much produces too much acid in your body. Eating the wrong type of foods causes your tummy to swell. There's food sensitivities, food allergies. They're not the same thing. So the laser went to work, and it did tissue healing and inflammation reduction. Now you see a little bit of the muscle and the skin and the fat, but she doesn't have a lot of fat to lose. This type of person would not typically be a very good candidate for plastic surgery because she doesn't have fat to remove. It's the other problems. So when you find a laser doc who works in the gut-brain axis and does the 5 healing components, then you get these kind of results. Okay, this is why I love the laser, and that's why when patients would sit through our in-house talks and be like, I had no idea it was this complex. It is, because remember, it's your body. Your body's very complex. And I tell everyone, after doing what we've been doing for over 10 years, I haven't had a simple case that's come in for body contouring in over 8 years. It's always a bigger problem underneath, and that's why diet and exercise aren't working, okay? So we slow it down and tell patients, remember, you're going to heal. That's the amazing thing. But you need to understand what's going to happen to your body, and then you need to be educated and taught how to maintain your results, okay? In 2018, I can't imagine anybody still thinking MSGs and GMOs are good unless they're in that industry, okay? There's so much proof now. I'm sure that'll get some comments. Okay, let's move forward and show you another case. And everyone that's treated, you'll notice they have that glow to them. That's the upregulation component. Okay, that's what's different, and here it is. It's pretty amazing. Once again, I missed it, but we're going to just keep going because I want everybody to be able to see this. Okay, here it is. Look at her. She's got that upregulation glow. The lady in red, thank you, Chris, with the blonde in red has got that something about her. Okay, this is the part of aesthetics that people want, just that glow, that natural, healthy look. The lady behind her, we always chuckle, she doesn't have that glow. Not yet. She hasn't had laser yet. You will look different. You will heal. You will feel different. You're going to love the laser. You're going to love the way it makes you feel. But it's more complicated. So remember, this is the second video to the first. And when you go through this, people are going to ask you what's going on. Now, you're just say, just watch the video, see what's going on. Here's some paperwork you can read. This is why we love the laser. This is why Zerona, even 10 years into this, it still is bigger than most people understand. So we're going to do a quick recap, and then if you haven't watched the first video, it's more of me doing a PowerPoint presentation. So let's do a quick recap here. We're going to go forward, and you'll see one more photo on the back wall. Remember, this video, there's also a 10-minute version of it online. So, okay, so there's the Zerona. That's how you want to dress. Let's come back to the whiteboard. So we're going to take your fat cell, liquefy the fat. The fat will begin to soften, okay? And it just depends on you. It depends where you are in health when you're going to see these things. Everybody's the same but different. Then the fat goes into the lymphatics. Lymphatics to liver, liver to bloodstream. That's a 3 to 5 day journey per treatment. So if you have 6 treatments, that's anywhere from 18 to 30 days. Now, once it's in your bloodstream, we have to turn you into a fat-burning machine. You've got to burn this stuff off, okay? Remember I said when I pulled my blood in year 1, first day I pulled it, it was about 125 for my triglyceride count. I did a Zerona treatment. Next day, had my blood pulled again. My triglycerides were 350. That's good. That's okay, because that means we took the fat from storage and put it in the bloodstream, and now we can burn it off. Now, that's a very dramatic amount of triglycerides. That's why we have the protocol, so you can burn that much fat. That's also why we have the Burn the Fat Now program, where we give you niacin, nitric balance, and CM Core, because you've got a tremendous amount of fat in your bloodstream that you want to get rid of. You don't want to restore it. You want to burn it off, okay? So you need a little help. That's why we do fat-burning exercise with oxygen. That's why we do all these things, so you can get results. Because if you don't burn it off, guess what? Right back into storage. Now, we're going to assess where you are in the gut-brain axis, in your tummy and your brain. Remember, your brain controls everything. Your brain controls your ability to lose fat, believe it or not. I know it's shocking. Your brain's pretty important. It's a fuel hog. It takes 30% of your daily intake to run it. What you're going to love about the Zerona is the Krebs cycle, where it goes to restore it and upregulate it. This is where patients are like, where do you get all your energy? Well, I have laser at home too. Okay, but sometimes it's like the plumber with the leaky sink, and I neglect my own health and don't get enough care, right? This happens first. More ATP, more energy, more metabolism, you can burn more fat. Remember the 5 healing components. You're going to get all 5 parts of this. I can't tell you how many times somebody comes in with chronic pain or doing body contouring, like, Doc, I don't even care about the inches anymore. This, and this don't hurt. I'm like, isn't that great? Because we use this for tissue regeneration, tissue healing, etc. Remember, the Zerona can't not do the 5 healing components. It just can't. So how does it know the difference between a muscle cell, a skin cell, hair? It doesn't. It just has a different effect on each cell. And when it finds inflammation, which is pain, it gets rid of it. That's what's beautiful about true cold laser, okay? That's why we don't waste our time on LED light devices, because they're a waste of time. Okay, I'm sorry. It's just the truth. True cold laser is a paradigm shift in healthcare, but even in 2018, it's still very young and organic, okay? It's just, you're just not going to find this on every street corner. Soon you will. So yeah, you're very passionate about cold laser. So I hope this video helps. There's a huge component to this Zerona that's just not understood to the public. You're going to get body inch reduction. You're going to get the fat loss. That's great. That's what everybody wants. But remember, that's what we call just a side effect. You're going to get all these other healing components, and you're going to love it. Okay, and that's why we have so many patients who just come in for autoimmune restoration or upregulation or maintenance, wellness. Wouldn't it be great to go into a clinic, say you've had the mishap and you broke your arm, like my son did, and say, you know what, we're going to have that healed up in about 2.5 weeks, and you're going to be fully healed. Wouldn't that be awesome to do that? Well, yeah, if you need to be functional, yeah, because not everybody has 4 to 6 weeks. So, cold laser, very phenomenal. Who we are a functional medicine clinic that specializes in true cold laser, very passionate about what we do. We've had every laser out there that a doctor could buy. Why do we stick with the originals? Because they're the best, okay? Why do we have all 3 lasers? Why are we the very few clinics that have all 3? Because we're very, very good at what we do. So I tell my patients, I start at 4 a.m., I end at 10 p.m. because I love helping people. Okay, and my patients span the globe. So we do a lot of Skype, we do very little in-house. Cold laser therapy, when you're going in, make sure you're getting a real laser, okay? And if the clinic has a real laser, they'll be very upfront. They'll tell you. If you have a Ferrari in the garage, you tell people. If you don't, you kind of tell people you have a vehicle. And that's how we perceive it. So, Dr. Don Jewell, non-surgical clinic, I hope this video helps, and we'll see you soon.